Hello, today at CFIM we're going to go over what is on the MSO dashboard through iMed communication portal. So the first thing you want to do is you want to log in. And then I'm going to go ahead and take you through the dashboard here. Now for the MSO portal, I'm going to go ahead and show you our screen or explain the screen from left to right and from top to bottom. So just as in any of the iMed screens, in your upper left hand corner you will always have a home button and a button for direct admits, which we will go into more detail a little bit later on. Down here we do have three tabs. We have an acute tab, we have a post-acute tab, and a non-CFIM tab. So first off, we will start with the acute tab. Under this tab, you will see two main sections, one being active patients by MSO, and the next one down here in the bottom, discharged patient list. If your particular MSO has an active patient in the hospital in which CFIM is the attending hospital list, this portion will populate. And here you will find your patient in the order of last name, first name. You will also see their medical record number, which will also have a hyperlink where you can access their H&P document, the admit date into the hospital, their current length of stay, which hospital campus your patient is at, the provider who is rounding on your patient, the diagnosis of this patient. What's great is you can also see which of your PCPs are attached to these patients as well. Any clinical notes. So let's say if your patient is extended, their stay is extended a little bit longer than normal, you will find a clinical note here as well. So you will have a clinical update as to what's going on with your patient. The payer that is tagged to this patient, and you have a CCD column as well. In this column, there will be a hyperlink next to your patient name where you will be able to upload any clinical documents that have already been completed at your PCP office, so we as your hospitalist do not duplicate any services. Just above that you will see two options. You will have an admission alert option and you will have an Excel spreadsheet option. Before going into the admission alert, I just want to cover the opportunity or the ability to export any data here in this particular form into an Excel format. You just click this button and your computer will download all of the patient information into an Excel spreadsheet, and you will have the ability to sort the patient accordingly and save it for your records. Now we're going to move into the bottom section of your dashboard. Here you will find a discharged patient list for any patients CFIM was the hospital list and has been discharged within the past 30 days. In this section, we will have the patient information organized in the same order as the top section. So you'll see your patient's last and first name, their date of birth, a medical record number, the admission and the discharge date from the hospital, which hospital campus the patient was at, who was the last CFIM provider rounding on that patient, and again, your PCP that is linked to this patient. Another thing that we have available is the diagnosis of this patient. What is neat about this spreadsheet for the bottom and the top portion is you're able to organize it accordingly as to what your preference is. So if you wanted to just see the patients that were most recently admitted or most recently discharged, all you have to do is click the column heading and this system will automatically organize the table into the appropriate format. You also have the ability to organize the table by facility or hospital and also by provider. I want to go back here to the MRN column. You'll see that there are hyperlinked numbers here. This is where you would have access to your patients or your PCP's patients' discharge summary. So just by clicking on the hyperlink, a discharge summary will pop up. Due to this being HIPAA compliant at this time, I'm not going to be able to pull that up for you. But when you are in the live environment, you will have the capability of pulling up the discharge summary. Now in this bottom discharge section, just as you saw in the active patient section, in the upper right hand corner, you will find an Excel logo where you're able to export this information into an Excel document. So you just click this button and it will download your Excel spreadsheet, and then you can format that document accordingly. So that's it for the acute tab. So let's go ahead and go to the post-acute tab. You'll find that again here in the upper left-hand corner. You just click on that link, and then we're going to see the dashboard for your post-acute patients. Again, it's the same format. You're going to get your basic patient demographic information in terms of the name, and of course here we have the date of birth. Here you'll also, since it's different in the post-acute setting, we have patients divided between long-term care and skilled care. We do have a status column here, so you can make sure that your patient is there for short-term care. You will see the admission date into the post-acute center. And remember, Central Florida Inpatient Medicine rounds in over 40 skilled nursing facilities. So in any of the facilities in which we are capturing your patient, they will populate here in this format. You'll also have a column for the current length of stay, the listing of facilities, the provider who is currently rounding on the patient. We're going to go back to this section in a moment. You also have the column for the diagnosis of the patient, the PCP in which the patient is assigned to, and any clinical notes on that patient. So what we try to do here as a best practice at CFIM is we include any clinical notes regarding your patient and any clinical updates, so you can always check in and see how your patients are doing in the post-acute setting. And then of course you have the insurance column and then the ability to upload any documents. So we will revisit this hyperlink as well in a moment. Let's go ahead and go back to the provider. You'll notice that the providers are hyperlinked. This is because you have the ability to message that provider directly if for some reason your PCP would like to have a peer-to-peer conversation. You simply click on the name. The facility name will pop up. Pre-fill this field. Same thing with the provider name in this new pop-up window. You will want to make sure you enter the callback number. The patient name will automatically populate, the contact person. You'll want to select a call type. The room automatically populates, and then you can just put a brief message. And then you click this page button here in the bottom right-hand corner. You will receive a call from the provider because that will get pushed directly to their phones. So that is a neat function and capability that iMed does have. Now let's go back here to the CCD column. You'll see another hyperlink. As we spoke about it under the acute tab, you have the ability to to upload any clinical documentation that you may have recently have provided to that patient. So let's say the patient was in the PCP office and has recently had an MRI, an X-ray, or certain labs or tests. You can upload that into this section, and then our provider will have the ability in the hospital or in the SNF setting to review those documents to make sure that we are not duplicating services. Now let's go ahead and go to the bottom section here for the discharge patient list. Just as the acute tab displayed, it mirrors the exact same columns: the patient information, their date of birth. You're going to see the status of the patient, whether they are skilled or long-term care. Again, the admission and the discharge date, the skilled nursing facility your patient was at, the last provider, CFIM provider who rounded on your patient, and the PCP who is linked to that patient. And just like above, you will see an Excel spreadsheet where you're able to export the document into an Excel spreadsheet to save for your records. I do want to note, if you go back up here, we have both on the acute and post-acute tab this admission alert, which is hyperlinked. So let's say you or your team has not been in iMed for a while or for a few days. If there are any patients that perhaps you have not seen pop up, you would just click on this link and it would tell you. This is blank, so this tells me we've been logging in here consistently and there are no new patients that we have missed. Last but not least, we have a non-CFIM tab here in the upper left-hand corner. Let's click on that. So the great thing is we partner with our payers and we do ask them to share the census with us, so that way we're able to track patients accordingly and help with preventing appropriate leakage. So on this tab, if for some reason a patient is not assigned a CFIM but is linked to a payer MPCP that's affiliated with your MSO, that patient information will pop up here. So then you will have the ability to track your patient, and you would also have the ability, if you would like to, for CFIM to continue care for that patient. So that's it for the dashboard. We've gone over the acute, the post-acute, and the non-CFIM tab. There's two other things that I want to go over, and that'll be it for this in-service. So in the very upper left-hand corner, next to your home button, you will see a button for direct admits. If you have a patient that's appropriate for direct admit into a skilled nursing setting or into the hospital, you have the ability of communicating with a team here on standby to direct admit those patients appropriately. You just click on this link, and a new window will pop up. This window will prompt you of all the information we need to get that patient started in the hospital. So you just fill out the appropriate fields. The red asterisks indicate that those fields must be completed in order for the form to be submitted. Now here where it says preferred facility and acceptable facilities, what's great about this is when we are working with your PCP office or with your team to get your patient directly admitted into the hospital, we can reach out to multiple campuses and find out wait times. So what we recommend is you select a preferred facility. So let's say your office or your patient lives downtown. So the preferred facility would be Florida Hospital South. But in case Florida Hospital South wait time is 12 hours to 24 hours and you don't want your patient to feel uncomfortable, you have the ability to select backup facilities. So maybe I want the CFIM team to look at the wait time at Florida Hospital Altamont, and maybe I want them to look at the wait time for Winter Park Memorial Hospital. That will give our team the guidance as to what the preferred hospitals are when we're calling in and getting your patient placed. Then we will call you and let you know the availability time for each of those campuses so you and your patient can make a decision as to which campus best fits their needs. Then all you do is you click the Request Admit button, and then that gets pushed through to our team on standby to get your patients direct admitted. Now as we return back to the home screen, we're just going to cover one last thing, and then that's it. In the upper right hand corner by your username, there is a drop down option. You'll see Report Issues and Log Out. If you have any issues with the iMed portal, we would love for you to please submit the issue request via this way. You'd be able to indicate what the problem is, and then you can add a full description. Or what we prefer is if there is an error message or if there's an issue, if you can screenshot it and then upload the document by clicking on this Browse button, select your file, and then click Upload, then click Submit once it's complete. That way, our IT team will have a more precise way of attacking any possible bugs or issues that you may have, which of course our goal is for that to not even happen. So last but not least, the way you log out of the system is you go to the upper right hand corner under your username and you click the Log Out button. And that's it. If you have any questions, please feel free to reach out to any representative with Central Florida Inpatient Medicine.